Okay. So by the time others join, I think a few more people are still to join. Uh, any questions about the last session? Any comments you wish to make or any suggestions you wish to make? Very briefly, if you would like to make a mention.
Hi, Dr. Indu. Very good evening.
Very good evening.
Yeah, Dr. Indu, I just want a clarity on this pedagogy thing. I mean, this is a kind of a new thing for me. So I wasn't able to relate to the term much. So it'll be
Wonderful.
good if you clear a bit about it.
Wonderful. Wonderful. Thank you for asking this. So since this is a master trainer program, so I am hoping after the program, you should be able to at least start conducting training programs in your own, work areas. I'm sure you're already doing it, but I hope that you will be able to focus more intensely on communication topics and other topics also, like quality implementation and patient safety, whatever your area of specialization is. So what happens, we are very used to using only PPT as a way of teaching and training. We prepare a PPT, we go and deliver the PPT and we come back. But there's a realization that just alone PPT will not help in making your presentation and your session effective. There are so many other ways. For example, when you share your story or when you ask your audience to share their story, or when you ask a set of questions that really stimulates them to think or reflect on their behavior. So there are different ways. So those training modalities broadly are called pedagogies. So in this program, I have devoted 2 sessions to particularly how do you develop a program that is, meaningful, impactful, and then also what are points you should keep in mind when you are conducting a training program. So these 2 sessions, like session 3 and 4, we are going to devote exclusively on these two topics. That is one thing. But besides that, I just thought that if I give a chance to each one of you to talk about one pedagogy. For example, you pick up, okay, I'll talk about storytelling, and then Dr. Manisha picks up, okay, I'll talk about videos, how to use videos effectively in a program, and somebody decides that, okay, I'll talk about, making a impactful PPT. So there is a list of topics that I will be sharing with all of you. And I will ask every one of you to just briefly, prepare yourself to talk about it for 7 to 8 minutes. And of course, before the presentation, you will be discussing your presentation with me. You will be sending your presentation to me. We will be kind of having a discussion around it. And then you will make the presentation. So one way you will get a chance to make your presentation. Others will get to know about the topic that you are going to present. And as a result, each one of us will be benefited by learning new pedagogies. Like sometimes we are not very, sure of how to use storytelling. So what is storytelling, how to use it, what are the benefits, what you should keep in mind when you're picking up this story. So that's the whole idea. Does that clarify?
Yes, absolutely. It is just that you're sending a message, so you want it to be the most find the most effective way to send it across. That can be
Absolutely.
anything. Few people understand a story better, few people want it verbally said, few people want it written. So this is how we find it. All right. Thank you so much.
But then there's a realization in audience, there are people who are just auditory learners. There are audience who are visual learners. There are audience who are kinesthetic learners. So we have to have a mix of all pedagogies in a session so that you're able to engage your audience. Ultimately, see, for example, if I'm taking a session for 2 hours and if I just rely on PPT, some of you may think that, okay, this PPT we can go through anytime. What is the point of spending 2 hours, especially from 8 to 10 evening hours, which are so important for us? But then we know there are so many discussions that happen, so many points that come up, and the way we conduct the session, it makes it so engaging that none of us want to miss the session. Dr. Neha messaged me that I will not be able to attend, or maybe I'll join late. But then see, she's there because she wanted to attend it. And I think most of us have very keen desire to attend the session. Thank you so much for asking that question. Any other question or feedback or comment anybody wants to make? Mamta, Payal,
Yeah,
Deepika.
very good evening. So
Very
I
good.
was just wanted to know that after this master training program, how this certificate is going to help us, and what kind of certificate are we going to get so that we can apply into our academic part or into career progress kind of.
So there are two things I must explain to you. For certification, I'm not making any assessment per se. Like I'm not giving you any questionnaire that you have to answer. All of you are seasoned people in your own area. So I don't want to treat you like kids to give you an exam and then you have to clear that exam, because I don't think that makes any sense. The whole idea is that each one of you will have to attend all the classes. If you miss by chance one session or something for a genuine reason, it is understandable. But if you're not attending, all the sessions, then the whole purpose of certification will be kind of, futile. You haven't learned, you haven't participated, you have not, done your share of responsibilities. So just having a certificate will not help. Even if you get the certificate from me, inside you will not be confident that yes, I'm trained and I can do the training. That's one part. Second is, certificate I give is from my organization, which is called Indian Institute of Healthcare Communication. Fortunately, over the years, it has gained that credibility that people believe that who are trained by IHC, they will be able to do good training, but depends primarily on your input. uh, Honestly, if you ask me, if you really want to be a subject expert, invest 10,000 hours. This is the concept not developed by me or given by me. Number of studies have proved 10,000 hours spent into any activity and you can be master of any subject. If you want to be a trainer, spend 10,000 hours and you will be an expert. Of course, if you apply for a job, if you're going for promotion, if you make a mention that I have done my master trainer program with IIHC, I hope it holds some value. But if you say, is it attached with the Health Sector Skill Council or any other university? I'm sorry, not as yet. I seek your blessings to get that recognition. But as of now, there's nothing like this. I brought up this banner of Indian Institute of Healthcare Communication because everybody motivated me to have a banner. That there should be a body that works. I would want more and more people to join my organization, and let's work together and see how we can create more opportunities, more revenues, more work for each other, and also learn from each other. Does that answer your question, Payal? Sorry,
Yeah,
Ma'am.
yeah. Thank you, ma'am. Thanks to you.
Thank you.
Actually,
Thank you.
a few of my friends have approached me, but I didn't had anything to tell them. I mean, once if I am done with this master trainer, then I can go and tell what I have learned, what is the benefits of, so that, yeah, many are waiting actually.
Absolutely. Ask any question that comes to your mind. I never think that a question is a wrong question. I may not have an immediate answer to that question. I'll excuse myself and I'll say, let me find out and come back to you. I'll not give you a wrong answer, and I will never refuse to answer you. No, that's not the question I'm going to answer. If it's not related to the subject, then I will pardon myself and say, I'm sorry, I think we're going out of the context of the topic. But then otherwise, I don't think any question is wrong, because you have full right to ask me anything about related to program or the credibility of the program. I'm building it with all of you, with everybody's support. So you're part of it. You're part of journey with me. Okay. So since all of us are there, I think except Dr. Three people are not there. Priya is not there. Lakshmi is not there. And then Dr. Kundar is not there. Dr. Priya is there. Okay. Thank you for the camera on. Dr. Priya, yeah, I couldn't see you, so I got confused that maybe you're not there. Thank you for being there. So two more people are not there. Priya, Lakshmi hasn't yet come back because she mentioned that there's some mishappening in the family and therefore she's out and away.
No, she's not yet joined back.
Okay, it's okay. I think we'll share the recording with her and then let her. See, for example, Deepika joined in one of the last batches, but incidentally, she could not complete all her sessions. And I think she happily accepted my thought that, she shouldn't ask me for certificate unless she attends all the sessions. She's attending with all of you now. Deepika, am I right in saying what I'm saying?
Perfectly, yes.
because even I didn't have the voice to ask you for a certificate because I didn't join this just for the certificate. But yeah, because of whatever reasons, I was not able to complete it in my last batch. So I'm more happy to do it with this session. Yeah.
And the kind of group that we have here, they're so enthusiastic. Your learning is going to be 10 times more than what would have been in the previous batch. So I would really honestly advise you not to think which session you have attended or which you need to attend. Rather attend all the sessions, and then, and then your certificate will be like it's a earned certificate, I would say. Thank you. Thank you. So moving forward with the discussion that we left incomplete in the last session, and that was we were trying to understand the benefits of effective communication in healthcare. Although we talked about a lot of things, but 3 things that I wanted you to focus, if you have clarity, how am I going to be benefited? So if you know how are you going to be benefited, I'm sure you will learn and apply and use this in your day-to-day communication. And I think we all, can you tell me quickly, one by one point, don't elaborate, just share one point each maybe. Personally, how do you think you will be benefited if you learned communication? If you worked on your
Great,
one by one.
ma'am. Makes hassle-free communication with the colleagues or with the workplace or wherever we are.
Excellent. I think very important. Communication with colleagues is very important. Don't take it lightly. It's very, very important and it should be valued. Very good. Sneha says safe and holistic practice. Absolutely. More you communicate, more patient safety, personal safety, employee safety you ensure. Communicate, communicate, communicate. Thank you, Sneha, for that. Better team dynamics. Absolutely. I'm going to ask you in the next session that we are going to start immediately after this, completing this. But I'm asking you right now, any idea what percentage of your success comes from your communication or your interpersonal skills? Can you guess?
More than 50%.
More than 50%. Any other guess?
70%.
Okay, another good guess. Any other guess? 85%.
85%.
Dr. Kundan says 85%. So Dr. Kundan, have you read it somewhere or you have an idea?
I think I have read it somewhere.
You have read it somewhere. Very right. Actually, 85% of your professional and personal success comes from your communication and interpersonal skills. So you can well imagine, and it's not me who is saying, it's a study done by Harvard and Stanford. They found out that people who have higher IQ, higher interpersonal skills, not IQ, EQ, not IQ, EQ, and higher communication skills or better communication skills, they are more successful than people who have higher IQ. So you can well imagine the importance of the thing. So we are benefited because our relationship with patient improves, with the family improves, patient trusts us more. We have better, relationship at workplace. We enjoy our work. You feel so energetic, happy doing whatever you are doing because you are enjoying your work. What about patients? If I may ask you, write in the chat box, how do you think patients will be benefited if we communicated effectively with them? I can see a lot of answers in the chat box for the previous question. Dr. Neha says interpersonal relationship everywhere and patient safety, staff safety. Absolutely. Safety is very good. Okay. Feel cared for. Patients will feel that they're okay. Reduce medical error. Yes, for both. For patient, it's patient safety, and for it's our safety. Why should the patient suffer? Patient should be benefited. What others benefit can you think of? Reduce medical error, patient and family education. Yes, I agree with you. Better trust and stop second guessing. Absolutely. Satisfaction, reduce error, patient loyalty. Patient loyalty is our benefit, honestly. But then, yes, definitely patient will have trust. Okay, reduces patient anxiety. Patient will have proper idea about choosing right treatment pathway. Yes, more clarity, absolutely. Get to know about what problems they are going through due to which they are admitted. Okay, they become more aware of their problems. I agree with you, Aditi. And then your care, compassion, and expertise all are perceived by how you communicate. Absolutely, I agree with you, Dr. Amrit. Absolutely. So I can see some more answers, better outcome, part of Dr. Neha Agarwal, I think this is what I was looking for. Can anybody believe, Dr. Kundan also has mentioned the same point, better treatment outcome. Can you believe that your communication can change the outcome?
Yes.
Actually,
Around 30% they say is just the placebo effect, or the trust they have on the doctor. So
but
the
very
immune system
honestly,
works
long
better.
ago,
Yeah.
absolutely, not very long ago, I was actually very confused about the word placebo. We normally used it in a wrong context, if I may accept. We thought placebo means we are giving something and the patient is thinking, okay, I'm getting medicine and patient is feeling better. But placebo effect has an impact on the body's physiology, psychology. It's not just that the patient is happy, okay, I've been given painkiller, so I am, I am recovering. And normally we used to give it to, since I did my study with drug abusers, so I know there used to talk about placebo effect, that we give some medicine and we say, okay, I'm giving you painkiller and you'll feel better. But no, actually studies have shown, let me share the screen with you and show you, okay, let me close this and then go to this one. Okay. So, there are studies that have shown that the patient outcome improves. So, for example, if I may talk about this case, there are multiple studies, but I picked up just a couple of them to, illustrate my point. Studies have shown that patients experience better pain control and improved response to pain management modalities. So patients who have good communication with their doctor and the other care providers, they have a better pain control. And then also chronic conditions like diabetes, high cholesterol, hypertension, HIV, which require long-term intervention and continuous, regular visit and regular treatment, even they have shown better control and effective management if they have better communication with their healthcare providers. Even in cardiac surgeries, there is a decrease in the post-operative complication, such as cardiac arrhythmias, where patient had good communication with the patient. So I think this must come as an evidence to us that it is not just the, somebody's, okay, let me see. Okay. So it's not
I just want to add that even in
please,
pediatrics, though, which is strange that the adult
yeah,
understands, but then because children, placebo effect has been proven even in children, in babies,
absolutely.
because the
Absolutely.
parents are more confident.
Absolutely. So it's not just psychological, it's physiological also. It's in terms of the body response to the treatment and the overall therapy. And also, like one of you had mentioned in the chat box, that it improves patient compliance. Absolutely. For example, chronic conditions like hypertension, diabetes, arthritis. So when you talk to them, when you explain them, when you ask them to take their medicine regularly, when you ask them to come for follow-up and you treat them with respect, care, concern, automatically their compliance improves. It will improve their outcome also. Also, their perception of the care changes. You have mentioned, some of you have mentioned in the chat box, they become more loyal to you. They believe that you are more caring, concerned, and effective in your approach. You are more knowledgeable also. So their perception about the care changes, and automatically their satisfaction level goes up. So all this adds to the recovery. So patients are, they go back happy. Of course, as an organization, we are benefited in many ways, but then it leads to patient satisfaction. That is what we are looking for. And then to the organization, if I may ask you right in the chat box, how will the organization be benefited if you had a better communication culture in your workplace? Right in the chat box. I'm waiting for your answers. I hope you're all writing, because I can't see any answer in the chat box. As an organization, how will you be benefited? My question to you was this.
You have written in the chat box, madam. You're not able to see.
No, only now I could see. I'm really sorry. I think it got stuck. I'm so sorry.
Yeah, because I have also written twice.
Yeah. I can see it now. Yes, I can see. A lot of answers are there. Oh, absolutely. So less complaints, of course, improved quality feedback. Yes, definitely better, better outcome, decreased cost of treatment. Absolutely. Less stressful working environment. Absolutely. Better outcome, decreased cost of treatment, better good interpersonal relations leading to better team dynamics, less error, increased revenue. Absolutely. Good vibes. Wonderful. And then
Less
improve.
legal cases.
Sorry?
Less medical legal cases. Actually,
Less,
it's up.
oh yes.
I've already written at the first point. I think it's already gone up.
Yeah. I can see. Yes, less medical legal cases, increase patient satisfaction, increase footfall, increase revenue. I think all of you have covered all the points. So I don't think I have to actually spend any time on it. Yes, Dr. Deepika, I completely agree. Employee and patient satisfaction improves. Employee satisfaction is equally important. It's very important to retain your talent. You invest so much of time and energy training your people, but unfortunately, people leave you and go if your work culture is not healthy. It's very important to make sure that your team also is happy working with you. So if I may briefly, just go through the list. That's all. I'm sure you have added more points than I have here. There will be good work environment. You will enjoy being there. Then, of course, there is enhanced safety for both the patient and for us. Of course, improved quality, greater job satisfaction. People will love being there where the work culture is good. Patient experience scores go up. Their feedback, their reviews, their Google reviews will automatically improve. Patient loyalty. Patient will not only stick to you, but will also send you a chain of patients. And of course, they will recommend to their friends and family and everyone. And then last but not the least, but overall, your Google reviews and general reviews will definitely go up. So just to conclude what we have discussed in the last session and in today's session, in this particular session, communication in healthcare is not about niceties. This one message I want you to clearly have in your mind. We think it is soft skill. Soft skill is just one part of it. A lot of it is communication that is with your patient, which is therapeutic communication. So when you explain to them about their disease, intervention, options available, risk involved, that's not nicety. That's an essential communication. It's the clinical communication that you will have with your colleagues. You are sharing patients' information. You are discussing a patient's case. So again, it is not just about niceties. It is essential communication, clinical communication that happens between you and your team members. And it is not optional. We really need to know how to communicate. You remember the activity that we did in the last session about medical errors happening because of communication failure. So we can't take it as an optional thing. We all need to learn it. We have to remember that implementing these communication practices has a direct impact on continuity of care, patient safety, and treatment outcome. And I think these three are our primary goals of healthcare. If you can ensure this, nothing will go wrong. And there are a set of communication protocols that every healthcare professional must know. We are going to discuss some of them in the next session that we are going to talk about. But then there are many more which I think we should continue learning as long as we are in healthcare. And there are multiple ways to learn and implement. Now, of course, we have Google at hand and we have so many other options where one must keep reading and listening to know what other things, we can implement. So this is to end the session 1 because this was left incomplete. So any questions about this before we move to the second session?
Ma'am, as you said that few communication protocols we will be covering, right?
Yeah.
Among the district. And say for the rest of the district, like we continue learning the process and, we continue having that. So like, is there any particular side book or anything that you will be recommending us?
So one is I have sent you a soft copy of a module I've sent around 70, 80 pages. I would request each one of you to read it. There are various aspects you will get to learn from them. Second, as I said, that I'm planning and I'm thinking, I'm trying to send you a complimentary copy of the book that I have written. So I would request all of you to share your, postal address with phone number, with your name, postal address, and phone number in one message. You can send it on my personal window. Don't, spam the common group. And I will try my level best to send a book. But I have a request to make, just to make sure that you read the book and just doesn't go into your library. I would want each one of you to pick one topic. There are, I think, 10 topics in the book. I want you to read at least one topic and then write your reviews on Amazon. Let people know that you have read it. Write your honest review. I'm not looking for any bias in my favor. No, just go and give your score, whatever your score is, and write whatever one chapter you read. So I'm sure once you will read it, we can also, see how we can bring this in this platform and learn from each other. What have you learned in that chapter? And that book covers almost everything that you require essentially in patient handling. So I'm trying my best to speak to the publisher and ask him to send a copy to each one of you. So thank you for asking that question. Any other point about this?
Yeah, ma'am. One point to be added.
Yes.
It's not about the hospital or the patient. It is also with the clients whom we get. If having proper communication with our clients, it will be a benefit to the organization where are we working. So in return, it's a personal growth and also organizational growth we can say see with the communication process.
Absolutely. See, principles of communication are more or less same, whether it is your personal communication or professional communication. And this is what we are going to cover in the next session. And they are applicable in both spheres, rather every sphere. You just need to be mindful that, okay, but what happens at certain places, we use them very, like being courteous, being polite. We are very courteous and polite when we know this person is very important. I need to behave very well with this person. But if the person sitting in front of me is not very important, cannot benefit me directly, we sometimes don't even care to attend to that person. So those basic principles, if we can remember in mind and apply in every sphere of life, you will see personally growing yourself. Definitely, you will get that reward automatically. I'm talking from my personal experience. So all of you have got connected with me, not because you know me personally, but I'm sure there is some impression you have about my work and the way I conduct myself that has brought you closer to me. Okay, thank you. Any other question, anything that you...
Yeah, Dr. Indu, when you were explaining us about how the organization will benefit or the patients will benefit, in your slides, you have mentioned some research papers. So just wanted that if you can help us give those research papers, because you have shared with us the crux of it. But if we will read, we will get an insight of how it works.
So
what you think is important?
I will give you the 3 slides full of references, around 45 references I can see here in front of me. I'll share all 3 slides to all of you in the group. Is that okay? Thank you. Thank you. So, and if there are no more questions, should we move ahead with the next topic? Okay. So the next topic is about understanding the, nuances of communication, finer details. Maybe you already know, maybe we don't know. If we don't know, then probably we'll understand the importance of knowing. If we know and we don't use it, then I think we'll learn how important it is to use them in our communication. So before we go ahead, I want to show you 2 videos. These videos have been done by Indian doctors. So this is doctor-patient communication. Most of you are doctors, but some of you are not, but I'm sure you can put yourself in that position and, and imagine how the whole thing happens. So when you're watching the video, in your copy, please keep a diary with you because we forget 80% of what we learn within 24 hours. So any key points that you like, keep noting them down. When you're watching the video, observe the video for the overall, behavior or conduct of the doctor. We are not talking about the patient's conduct, but we are trying to learn from the doctor's conduct. So watch the video, and then I will ask you to give your observation in the chat box. So give me a second to start the video for all of you.
Next. What? Doctor, my leg is swollen and painful. Since when? For the last 5-6 days. What were you doing? Why did you wait so long? This looks pretty bad. Doctor, I thought the pain was just a strain in the leg. Anyway, what do you think now? You could have waited for some more time and we could have amputated your leg. Leave it. What's your sugar level? It is under control, doctor. The fasting was 140. When was it done? What was your HbA1c? It was 4-5 months ago. Actually, HbA1c is an expensive test and I was feeling all right. I can't understand. You do investigation according to your will. You don't take proper treatment. You don't follow our advice. I don't know why you need doctors. And you come up with all sorts of complications like this. And what did you do with your leg? I went on a pilgrimage to Sabrimala, so had to walk barefoot. I might have injured, I think. Barefoot? Hello? Yeah. Who? The patient Ram, HIV positive patient. So he doesn't want CT scan. So tell him if he wants treatment, he needs to undergo CT scan. Right, what does he think of himself here? Prime Minister or President? See, discharge him against medical advice and tell him not to come to this hospital once again. Okay? Yeah, bye. And you got this boon. I'll tell you, if you go once again, you will also go near the God. Didn't I tell you about the foot care when you came last time? Huh? And your smoking is continuing without interruption, I guess. I have reduced a lot, doctor. I am smoking only 1 or 2 cigarettes a day now. Can't understand your attitude here. You do smoking, you are overweight, you don't take medications, you don't do investigations. I don't know what to tell you. I'm trying, doctor. And if you don't want to see me, I could consult someone else. See, whatever I'm telling is for your good. I don't know how to tell. I gave you information leaflets last time and you're not following my advice. And if you don't want to see me, it's fine with me. I have got enough work to do. I've got enough patients to see. Sister, please call the next patient.
So all of you have already started sending message in the chat. I can see the chat box, but at the same time, I would request that if you want to write directly in the chat box, then don't post it. Keep writing whatever you want to write, but then post it once the video is over, because otherwise everybody gets distracted. And also your focus is on writing and not on listening and observing. Okay, so you got an idea that the doctor's conduct was not okay. And some of you have written the answers. I can see Dr. Amrit is putting the patient down, getting defensive, arrogant behavior, using negative words, discouraging the patient, empathy is lacking, inserting his personal beliefs, absolutely, inserting patient's religious beliefs, then diverging sensitive information of another patient. I think that's a very important point, Dr. Sneha, that you have pointed out. At times, without knowing, we talk about patient's information about in front of others. Then doctor was not compassionate. Absolutely. He took phone call in between. I agree. He took phone call. Could be it's very important. It was urgent and he had to take. But do we ever say sorry to the patient? I'm sorry I had to take this call, or sorry I need to take this call. I don't think we ever say sorry to the patient. So taking phone call, maybe if it's urgent and keeping it short and crisp, you can take the call, but at least using basic courtesies or extending basic courtesy to the patient that I'm sorry, I need to take this call. I mean, there's nothing wrong. Then of course, he did not address the emotional part. He was rude, Aditi, I agree with you, and did not address his emotions. Yes, sarcasm, absolutely. I think Sneha, Aditi, both of you have pointed out to the very disrespectful. I think again, a very good point. Doctor speaking from a disrespectful pedestal, putting the patient down. Yes, and this is very true. We put ourselves at a higher pedestal. Why? Are patients not human beings? And they come from, is someone talking to me?
Ma'am, I just wanted to say the patient entered the room and the doctor didn't even introduce himself and never asked him to please have a seat. Give me a moment. He was busy doing something. It's okay. He was busy doing something, but he could have just respectfully asked the patient to take a seat and he'll get to him in a minute. So that
and
is
how did
just,
he ask the patient to take seat? Did you notice? With his eyes.
Yes, with his eyes.
When somebody does like this, that means I don't care for your.
I'm more important.
I'm more important. You're less important. And then the first word that he said, what was that? Do you remember? What? That means, what is it? Why are you here? So that itself shows that probably I'm not very keen to, attend to you. Yes, I think most of you have given wonderful answers. Patient seemed invisible. When patient entered, he didn't even acknowledge. Absolutely. So no basic introduction, feedback of past prescription. Doctor not maintaining confidentiality. Doctor behavior is rude. He was prejudiced. Absolutely, I think sarcastic, reprimanding. No eye contact when the patient arrived. Yes, no value for emotional beliefs or spiritual beliefs. Absolutely. People go bare.
Yeah.
Yeah.
Before doctor, I mean, since we see before giving any treatment, this doctor has to establish the doctor-patient relation first, or the rapport first.
And why only for doctors? If I'm on front desk staff, then it's my duty to first, build rapport with my patient. If I'm a nurse, then it is my duty to first become comfortable with my patient. So it is for all of us, wherever we are. If we are handling public, if we are handling patient, each one of us need to practice these basic courtesies. And I fully agree with you. All of you have
criticizing instead of giving advice, which is.
Yes, he made mockery of patient. Yes, please go ahead.
It's the patients only. They say it to the doctor, doctor, आपसे बात करके मैं ठीक हो जाता हूँ. What is it? It is just communication. It is how you're talking to the patient, what you're making them feel. So that is how it should be. आपसे बात करके वो और बीमार नहीं होना चाहिए. आपसे बात करके वो ठीक होना चाहिए.
Dr. Amrit, there was a time when I was a child. I'm talking about almost 50 years ago. I remember there was a physician. He was not a pediatrician. I'm sure उस वक्त pediatrician होते ही नहीं होंगे आज से 50-60 साल पहले, या होते भी होंगे तो they were not like very good in number. So my mother used to take us to a physician who was an MBBS doctor. His behavior was very rude, very rude. But my mother will still take us there. नहीं वो बहुत अच्छे डॉक्टर हैं, उनकी एक दवाई से आराम आ जाता है. आज अगर आप अपने पेशेंट से रूड बात करते हैं, पेशेंट दोबारा मुड़ के आपके पास वापस नहीं आएगा. उसे पेशेंट ने कहा ना लास्ट में कि भाई ठीक है, if you don't want to attend me, I can go and see another doctor. And this is what is exactly happening. Yes,
he did not even care also. He did
yes,
not
he did
even
not.
care also.
That's how we
Can I
Ane to all
Dr. Indu, can I quote one incident from my experience on this?
Yeah, but I would request you to keep it very short, because
very short.
I'm really sorry.
Short.
I never say this, but then
just very short. Lung cancer patient, and 4th stage, roaming around for pain relief for many years, came to our setup, and I gave good communication with him. In the end, he said, after talking to you, my 70% of pain has gone. And he had come from the Tata Memorial also. He'd been running to that. And when he came to me, and he was a journalist.
Imagine. I think that's the true impact of communication you can see right in front. Absolutely.
Also, everybody forgets the psychological element in our suffering. And that can be only satisfied if we get compassion and the right kind of listening from the person we are communicating to. ये बहुत गलत है सोचना कि
just about psychological, that mental
health human
actually releases the hormones in the body that helps us recover. And we have to understand.
Human beings are sentient.
Absolutely.
Yeah, they are sentient. So we need to treat them with sensitivity always.
I completely agree with you. So let me show the second video and see if he could have, handled it in this manner. Let's see this video. Yeah. Thank you. I can see a lot of comments in the chat box. I'm not able to read all of them for the paucity of time, but I'm very glad that all of you are very actively participating in giving your thoughts. Thank you.
Next. Hello, Mr. Kannan. How are you? Please take your seat.
Thank you.
What can I do for you?
Doctor, I think I have a problem with my leg.
What happened?
4-5 days back, I went to Sabrimala, and I had to walk barefoot for some distance.
Mm-hmm.
I'm very scared now because my leg is swollen and painful in the last 4-5 days, and I think I did a stupid thing by walking barefoot.
Let's see what we can do. Good that you realize the importance of foot care. Meanwhile, how are your sugars?
Actually, my fasting sugars was 140, but it was some months ago. I was feeling all right, and I didn't do the HbA1c. It is so expensive,
It is expensive indeed, but it is so important to get the investigations prescribed by the doctors, because otherwise it's very difficult to give the treatment, and treatment may not work as well. Anyway, can I examine your leg?
Yeah, sure. Sorry, sir, it was my mistake. I didn't do the test.
Hello? Yeah? Yeah. Excuse me for a moment. Yeah. What's the name of the patient? So he doesn't want the CT scan, right? Yeah. Try to explain to him the importance of CT scan. Yeah. When I come for rounds, I will also tell him. Okay. Thanks for informing. Thanks. Bye. Sorry about that. You got infection in your leg. So how are we doing regarding the quitting the smoking?
Regarding smoking, it's doing good. Actually, I brought it down to only 1 or 2 cigarettes per day now, doctor.
That's good. but total quitting is very important. See, if you have reduced from one pack to 1 or 2 cigarettes per day, quitting that is also not very difficult, you know. And how are we doing regarding the exercise?
Yeah, going on, but I must admit, not so regular.
See, exercise and diet are as important as your medicines, if not more. But for the time being, you need admission for sugar control and control of this infection. Is it okay with you?
Whatever you say, doctor, you have to cure me this time, and hereafter I will definitely take care of myself. This will not happen again.
Yeah, we need to control your sugars and control the infection. Otherwise, it may go for gangrene and may lead to further complications. Now, the sister will go through the procedure and admission process. Okay. And meanwhile, you have this leaflet and you can go through it, which will help you to follow the regimes. Okay. Thank you very much.
Thank you so much, doctor. It was so kind of you.
You're welcome. Thank you.
So I hope you got some idea how we could, deal with any situation in a more calm and composed and professional manner. And if you saw the longevity of the video, this video took shorter time than the previous video. Only thing is we need to be mindful of the way we behave, the way we communicate. So just to understand that, let's go with the presentation that I want to share with you, and it has a lot of activities in it to learn from, learning by doing. So this topic that I said will be, on developing communication competency, which is more to do with the understanding of nuances of communication. Let me show you the presentation. Okay, there we are. I hope you are able to see the slides. I can see some answers in the chat box. Yes, more kind and accenting human nature. Mistake. Praising good, done, well done. Yes, compassionate but firm and clear attitude of doctor. Thank you, Dr. Amit, for this. Slower pace and kinder words. Yes, I completely agree. So that means we could see that he was very professional in his approach, but he was not arrogant or he was not misbehaved with the patient. So I had asked you this question, that what percentage of your success comes from your communication and interpersonal skills, and precisely all of you, were very close to the answer, 50, 60, 70, 85%. And that's actually true. 85% of our success comes from, on our communication and interpersonal skills. Unfortunately, we pay a lot of importance to technical skills, that they are required. There's no doubt about it. But if you lack communication skills, the growth chart of your, professional growth, you can see yourself. Now, if I may ask you, in how many ways do we communicate? Any idea? What are the different ways that we communicate?
Verbal and non-verbal.
Verbal and non-verbal. And what does in non-verbal come? Very good. What all comes in non-verbal?
Our posture, our tone of voice, the pace of voice, our face expression,
Gestures,
the distance
eye
that
contact.
we-
Eye contact, body language.
Absolutely. So any idea what percentage comes from words and what percent comes from tone of voice and what percent comes from our body language, which includes facial expressions and...
They say 90% non-verbal.
Okay, 90% non-verbal. What do others say?
I think 70% is usually non-verbal.
Non-verbal is 70, 70, 67 to 77%.
Because tone of the doctor also matters.
Wonderful. Yes, absolutely.
7% is only said as communication.
Oh my goodness! Somebody has read it somewhere.
38%.
Can you believe
Yeah,
it?
I have read your material earlier last week.
Only 7% of the communication happens through words. Do you know that? 38% is the tone of voice. You will see this when we will do some activities around it. And 55% is your body language. We will try to understand each one of them briefly. So for example, if you're talking about words, if I may ask you, do words matter? Do words matter?
Yes, they do. Yes, they do.
Absolutely.
Yes, they do.
They do. Let's do a small activity to understand how do words matter. So I just want 4 of you to stay in the main area, and rest of you, if you can switch off your video. But I want 4 volunteers, including me, will be 5. I need 4 volunteers to stay, and rest
Okay.
of you can,
I will
temporarily
volunteer.
go back with your video. Yeah, go down with your video. Yeah. Okay, Dr. Neha is volunteering to be there. Who else? Payal, will you be there?
Ma'am, I
Okay.
will be there.
Okay, Dr. Manisha is also willing to be there. Aditi, will you be there? Okay, thank you. Aditi, will you be there? Mamta, will you be there? So we have how many people? Others can switch off their video. You'll be just listening to what we are doing. Yes, Payal, be there. Yeah, okay. It's okay. We are 7 of us, including me. That's fine. Okay. So imagine that we all are going for a picnic. There was somebody who switched off the video. You can be there, Sneha. You can be there. It's okay. Yeah. So imagine that we all are going for a picnic and we are discussing the plan of picnic. And we start the discussion. Each one of us will start the discussion in a particular manner. What will we say? I'm okay with the plan of picnic, but. So I'll start and then I'll pass the baton to Sneha. Sneha, you pass it on to the next person, to whomever you want to pass it. Okay. Okay. So I'm okay with the plan of going for picnic on this Sunday, but problem is I have somebody coming home. Sneha, your
I'm
turn.
okay with the picnic, but the mode of transport is not convenient for me.
Whom do you pass it?
Manisha ma'am.
I'm okay with the plan of picnic, but I don't know, will I be able to make it?
I understand. So whom do you want to speak next?
Aditi?
I'm okay with the plan of picnic, but the place is really far away from my place. So I don't know, will I be able to reach on time or not?
I understand. Whom do you pass the baton?
Payal.
Payal.
Yes, I'm okay with the plan of picnic, but I need to make some arrangement. So give me some time and I'll get back to you within 1 day or so.
Okay. Whom do you pass the baton?
To Mamta.
Okay.
Good that many are willing with the plan. Yes, it is good to go, though there are some challenges. We will plan accordingly and make sure we all will go together, or if it is not working.
Mamta, stick to the dialogue that I have shared. I'm okay with the plan of going for picnic, but that's all. After but, you can give your own reason.
Okay. I'm okay to with the plan of the picnic, but yeah, need to make some arrangements so that everyone could join.
Okay. So next is Dr. Neha. I think she's only left for this. Yes, Dr. Neha.
I'm okay with the plan for going to the picnic, but I really need to know what are the expenses involved. So it will be very nice if I first come to know what will be the total expense. And then I would definitely like to join.
Thank you. Thank you. So now we will discuss it.
I am also left.
Okay, Dr. Amit, you want to participate? Okay, yes, Dr. Yeah.
Yeah, I'm okay with the plan of picnic, but yesterday I developed some upper respiratory tract symptoms. So I'm not very sure I want to go because of this COVID thing happening. So I'm a little confused.
Yeah. Okay, thank you so much. So we will have the discussion once again in the same order. Please remember your order after who is going to speak. But we will replace this word but with and. So instead of saying but, we will say and. So I start the discussion. I'm okay with the plan of picnic and I'll get food for everyone. Sneha, it's
I'm
your
okay with the I'm okay with the plan of the picnic and I'll make alternate arrangements for the travel.
Wonderful. Dr. Manisha, it's your turn.
I'm okay with the plan of picnic. I'll get all the disposable plates and cups for
Thank you.
everyone.
Who is next?
I'm okay with the plan of picnic and I'll try to reach on time so that I can enjoy more.
Wonderful. Thank you. Who is next?
Yeah. I'm okay with the plan of, yeah.
Please. Fine.
Yeah. I'm okay with the plan of picnic, and I'll arrange all the caps and the sunscreen and whatever the first aids we need to take it for us.
Excellent. Excellent. Who is next?
Yeah, I'm okay with the plan of the picnic, and I'll make sure that I'll get one nice digital camera so that we can capture all the memories.
Excellent. Wonderful. Dr. Neha.
I'm okay with the plan of the picnic. I'll arrange some games so that we all can enjoy more.
Excellent. Thank you so much. Dr. Amrit.
I'm okay with the plan of picnic, and I make sure that I get some good music along and get a dish for everybody, surprise dish for everybody.
Wonderful.
I'm
And I'm sure
everybody's
your
going to like it.
also will go down. I'm sure your infection will also go down. We still have 4-5 days.
Definitely. Good company helps.
Thank you so much. Thank you. Can I ask everyone to come in? Have your cameras on, Dr. Santoshi, Dr. Priya, Dr. Kundan. Okay. Those who were listening to the conversation, I want you to share your feedback by unmuting your device. What did you observe? Those who were observing.
So just, yes.
Okay, Dr. Kundan.
So, and the narrative was about but, that is, and the narrative of and. So by just changing a word, the whole of direction of the plan went from a opting out negative to a positive inclusive plan. Just by changing of the word, that changed the mood of the group and the direction.
Wonderful. Thank you. What other change did you observe, Dr. Priya?
I majorly noticed when the adjective was a but. I only noticed Dr. Neha, who was more on a positive mode when in compared to others. She went, though it was a but, she put it a little more positively. But when it came as an and, it was more of a welcoming, and it was like everybody was for it and wanted to make it a success event. So that felt good.
Wonderful. Wonderful. So Santoshi, if I may ask you, were all but after but were really genuine buts?
See, when as everybody said that when we added when there was but, so all were more on a negative side, like they all wanted to drop out. But when and was added to the conversation, like more were all were very optimistic. They were trying to join the plan and they want to make it a success. So when we join the things together, I feel that it is more in a positive sense that we all want to do it. But when we add that but or lekin, the moment it comes, it is more like we are more going into direction where we do not want to do that. It's like but is always with a hindrance. It brings some kind of hindrance to the activity.
Absolutely. So Deepika, do you see that we a lot of time use but unknowingly and we create buts?
Yeah, I totally agree, because with but I felt that everybody took a second or they paused a moment to actually think about an excuse. But for and I saw people popping out with answers like, that's something which added or changed the entire mood of the session. Yeah.
Absolutely. And we use these ifs and buts very often without knowing that they are more of a trouble and they have negative impact on the teamwork. So you will have people around you, and some of us may be having this habit of using certain things, certain dialogues we repeatedly say, or some taglines we say, which are very negative. Can you think of something that you say often and you think that's very discouraging or rude to others or not a very healthy comment to pass with our family members sometimes, with our co-workers, with our subordinates, with patients also? Can you think of?
So often it's more
Yes.
generalized. Like it is more generalized when we use often. Like even if
Yeah.
I'm not doing it, but if you are saying me
Ah,
that, like Santoshi, often I have seen that people are doing this. So you are all. I feel that I am also part of those generalized communications which are happening. So when we use
absolutely.
often, it is we are involving that person.
Yeah,
Like maybe he's not a part of that activity or that kind of act, but we involve him indirectly.
absolutely. कभी कभी हम ये कहते हैं ना, तेरे बस का नहीं है ये, कह देते हैं ना, तेरे से नहीं होगा ये. It's not your cup of
Yeah,
tea.
it is quite loosely used.
Quite loosely used. Very often we say things like this. अरे वो useless है. I mean, we make such generalized comment about people. So we really need to be mindful of the words that we use, because a lot of time they are very damaging. Even when we are, interacting with our staff or with our, nurses and support staff and even residents, I see a lot of consultants being very, rude and embarrassing their residents. And I mean, they don't hesitate even demeaning their staff in front of the patients and so I think we really need to be careful when we are treating our people in front of others. So a lot of kind of errors that we make in our patient handling or in general with people with our staff. One is that we sometimes use disrespectful language. A lot of us sometimes use tu kar le, tum kar lo, tu chala ja, tu chali ja. With residents, I've seen them doing. With nurses, I've seen senior consultants doing this. So maybe you are doing this out of, kind of showing that, okay, we are very close, so I'm using this word. But I think in today's time, nobody likes to be addressed like this. So we got to be careful not to use these kind of terms. At times, we become very rude, authoritative, and uncourteous to our staff, to patients, and their family members. We snub others by using foul language. I've heard doctors saying, patient who would ask a lot of questions, say कि तुम इलाज करवाने आए हो कि मेरी knowledge check करने आए हो, इतनी बातें पूछ रहे हो. So when you snub your patient like this, they will dare not ask you. Baba, ज़्यादा कहानीबाजी मत करो. I know in private sector we don't talk like this. We don't verbally snub the person, but through our body language we communicate that I'm not interested in listening to what you're saying. And we don't offer basic courtesies like thank you, sorry to patients or to our juniors, because we think we take them for granted. So these are common errors we make, and I think we need to be more mindful of these things, because that's what is going to build your relationship with your patient, with your family member, and also with your staff. Now coming to the written communication. Written communication in healthcare is very important, because not only this information is going to be used by somebody, and any error can be very fatalistic, but at the same time it's a medical legal document. Tomorrow you can be in trouble if your written communication is not accurate. Now look at this sample. I received this from one of my gynec friend. She shared this. I have removed the name of the hospital because I don't want to defame anybody. What errors do you see in this document? What errors do you see?
First thing that I notice is patient details are missing, or
Yes,
okay.
absolutely. And this is not a, this is not a fabricated document. This is actually a genuine document written by a resident and, seen by the consultant. And she shared with me, she said, this is what my resident has done.
Here they have directly mentioned Lama. So he has documented that thing in the prescription, which I feel it should be documented.
Patient details are missing and doctor's details also missing. The name of the doctor, registration number is missing.
Absolutely.
Yeah, and the treatment is in the running handwriting. Error prone abbreviations are used.
It is not legible also.
The complete story is not, it's not easy to understand the complete picture. It's only haphazard. And more emphasis is on the why the patient is leaving rather than, giving the proper history.
Absolutely. Absolutely. Now look at this second document. What does it say?
Nothing can be understood.
And writing is so bad.
It
is not legible.
bad. Can you understand what it is?
Writing can't be understandable. No clear.
So he has left it to the patient. The doctor has left to the patient or the pharmacist or the nurse to see what needs to be done, what needs to be done with this. And in written communication, there are a lot of documents that are medico-legally important, and they're important for the continuity of treatment and also patient safety. Things like case notes, prescription, referral notes, progress note, nurse's note, operation notes, procedure performed, critical lab report. These are all so very, very important. And you see the quality of writing that we do, you can see how many errors can happen in that. By the way, what are the common errors that you get to see? So this is another prescription I received for a patient of mine. So I have, struck the name of the patient and of course the name of the doctor also. Just see the details the doctor has written in the patient's OPD state. What are the common errors you often see in written communication? Though we know it's such an important communication. Can you think of common errors?
Time is not mentioned.
Understand the handwriting.
So not only in this, but in general. I'm talking about not only in this, but in general.
Time and date not mentioned. Not writing in capitals, the drug names in capitals, and
I know now it's been very strictly, asked that please write in capitals so that there is no error. So one common error is illegible handwriting.
Trade names are being given. So that
absolutely.
is the confusion.
Absolutely. So people use a lot of abbreviations, even non-standard abbreviations.
Most confusion is about the name of the medicine and the repetition. This is where this is the most important thing the patient wants to know, and that is the least clear thing in a prescription I have seen so many times.
Absolutely, absolutely. A lot of time it is done but not documented. So the same gynec, she shared with me that in her hospital in emergency, a patient, came in labor, and the lady received magnesium sulfate, on stat basis because whoever was there, that person wrote injection magnesium sulfate stat and then transferred the patient to labor room or the gynae emergency. So this patient received the magnesium sulfate shot and then she was moved to the labor room or labor emergency. But unfortunately, the doctor who gave this medicine did not take that this patient has received. Now this patient went to the labor room and she was given the second shot of the medicine, magnesium sulfate, since she thought that, the patient is still to receive the medicine. Patient went into respiratory distress and landed up into coma. So a lot of time when we do and we don't document, that can be fatalistic. Another common error you will see across is documented but not done. Nurse goes to give injection or some medicine, the patient is not there. She says, okay, I'll go and give it, but it is the last time of the last hour of her duty. So she just signs all the documents that, okay, done. This injection I'll give before I go. Patient does not come. She forgets to tell the next nurse and the patient does not receive the medicine. But it is documented, it is done. So you don't doubt that it is not done. A lot of time we have seen the document is not signed, dated. We don't sign the document. Why? We don't like to write our full name. Why? Because we are hesitant to admit that this document has been created by me. We are not confident of our writing. I think one thing that we have to learn is how to write. Language can be a barrier. A lot of us do not know good English. So we have challenge writing, so we avoid, poor writing skills we have not learned. We have not been trained. How do you go about writing nurses' notes or doctor's note or resident's note or surgical notes? We just learn, in whatever good way we learn, and then we use it. But unless somebody is trained in doing that, there are so many good, protocols available on how do you go about writing patients' case history and other details. It is beyond the scope of this program. Otherwise, we could have discussed that. But one should really learn how to go about documenting patients' history. So the whole idea is that writing skills are very important, and wherever we are, whether we are in quality or on front desk or a nurse or a doctor, we need to know the right language. Second part of communication is paralanguage. What is paralanguage, by the way? What is paralanguage?
Non-verbal. Body
Non-verbal.
language, expression.
Absolutely. Okay, so
stance.
Language is words. Paralanguage is how you deliver those words. And trust me, more than the words, it is how you deliver the words that has an impact. So your pitch, volume, speed of speaking, the quality of your voice, intonation, everything has an impact of communication. 10% of the conflicts are because of wrong words. 90% of the conflicts are because of the wrong tone of voice. For example, if I ask you to read this sentence that I have written 6 times, put little emphasis on the word that I have underlined, and you will see the meaning of the whole sentence completely changes. The intent of the sentence completely changes. Do you agree with me?
Yes.
रोको मत जाने दो. रोको मत जाने दो. Change the position of pause, meaning changes. So in public dealing, I think tone of voice plays a very big role. Those of us who have this tendency to use unfriendly tone with patients and in public, or we somewhere show disinterest and unconcern, or we are not confident of what we are saying, or if we are rude and authoritative or aggressive in our approach, trust me, this is not appropriate. In public dealing, appropriate tone of voice is friendly. When I say friendly, I don't mean being personal. It's just being welcoming and respectful with the person. We have to act responsible because we are holding a position. There is some expectations from us, and we need to be, knowing what's my role. That will come if you have confidence in yourself, if you have subject knowledge. At the same time, we have to be soft and polite because we are in public dealing. We are not into any aggressive reaction, but also we need to assert. Assertion, we are going to talk at length in one session. So you'll thoroughly get to know about your communication style and also the benefits of assertion. We'll talk about it. But that's the tone of voice that is required. Inappropriate tone of voice can actually land us into violent and aggressive reactions. Please remember. So we need to be really, really mindful of our tone of voice. High pitch voice, high pitch, high tone voice, shrieking voice, shouting voice can trigger aggression. Please make sure that you don't call for problem. So a lot of time we don't shriek, but we are very soft. Again, if you're very soft and not audible, patient will not understand. One, patient may not ask you to repeat because patient will feel it's not good to ask. समझ नहीं आया. And if the patient asks us, Doctor, समझ नहीं आया, दोबारा बताइए, what will happen to your tone of voice?
It might change because sometimes we want to answer, and sometimes if we are in a hurry, or if we think why is asking, it's so simple, we respond accordingly. We react accordingly. I would not say respond, we react accordingly.
So that means we should
Someone can get irritated also by if someone is asking the same question again. And you can answer in wrong tone.
Absolutely. और तीसरी वाली पूछ लिया तो हम क्या कह देते हैं, भैया अपने पहले कान चेक कराओ. आपके कानों में कोई दिक्कत है, आपको समझ नहीं आ रहा क्या? especially where we can show this kind of, expression to the patient. With educated patient, I don't think we'll do this, but expressions will change. But with uneducated patient or poor patient, we have a tendency to be rude. And so it's very important to speak in a clear and audible tone where the person can actually understand. Even the speed of your speaking plays a big role. A lot of us speak very fast. So if you speak very fast, patient will have difficulty understanding what you are saying, especially if you are explaining about some disorder or some condition. If you are using technical jargon, patient will not understand. And if you are going very fast, they will not check you. They will not say, Doctor, thoda sa dheere samjhaiye. They just keep nodding, but actually they have not understood. Even in situations where patients, ask for some favor which you don't want to give, or if you're handling a patient who's an aggressive patient, I think we have to learn to handle such situation in courteous, polite, and firm manner. As I said, this is assertion. We are going to, talk about it in length in session 5 or 6. I think we will be talking about it at length. So this is little bit about tone of voice and speed of speaking. So in future now, when you are interacting with people, look at the person's facial expression. You will get to know whether this person is understanding or not. So trust me, even in front of me right now in my whiteboard, I've written, speak slowly, because sometimes unknowingly my speed of speaking goes higher. So this is more like a reminder to me that I should speak little slow so that the other person can comfortably listen to. So this comes with a lot of practice, but anybody can learn it. Okay, so what do you see in this picture?
The person is angry. I think he is shouting on the phone.
Absolutely. Angry, shouting. You have not heard a word. You have not even heard what he is saying. But you have been able to very accurately, assess that this patient is shouting, is very angry, because 55% of the communication happens through body language. Actually, your actions speak louder than words. When you are interacting with your patients or anybody, with your staff or anybody, you may be saying something, no, I'm not angry, or I'm understanding. But if your body language is not matching your verbal comment, trust me, patient is not listening to you. Patient is observing your body language. Let's do a small activity.
Even if it come to staff also.
Even if come to?
Staff also, like employees.
Absolutely. Even at home with your family members, everywhere. As I said, most of the principles of communication are, applicable in all spheres of life. So can I request everyone to be, there? Who is not there? Okay, Santoshi, I understand you said you will not be. Okay, so I'm going to take you to your childhood. You remember that poem? If you're happy and touch your nose. You remember this? If you're happy and touch your ear. Will you all do this with me? We'll play this game. Okay, ready? So have your hands free, both, all of you. Deepika, phone रख दो, पेन रख दो, हाथ खाली कर लो दोनों. Show me both hands. ठीक है? So जब ये कहेंगे touch your nose करने के बाद में we have to clap 3 times. ठीक है? So एक पहले practice session ले लेते हैं, फिर उसके बाद में आगे चलेंगे. If you are happy and touch your nose. Do with me. I want everybody to do. Yes. If you are happy and touch your ear. You're not with me. All of you need to be with me. Or is the internet problem causing this delay? Is it? Dr. Manisha, I'm not able to see your response. Maybe video is stuck.
No, ma'am.
Is it with my internet?
Ma'am, there is something wrong in the connection, because I see you moving a little. I mean, I can hear you very clearly, but sometimes in between there is a blurredness in to see your picture. So I don't know.
All others are also facing the same thing?
No.
So maybe that means your network is maybe. Okay.
Yes, ma'am. There is some issue in my network. Although I'm sitting nearer to the.
Okay. So let's do it once again. If you're happy and you know, touch your nose. If you're happy and you know, touch your ear. If you're happy and you know, touch your chin. I want you to do with me. I want all of you to do with me. I can see, I am not able to see, your videos also very clearly. Maybe if I log out and log in once again. I'm logging out and then I will, log in. Give me a second. Okay, I think now I'm able to see everybody's video moving. Otherwise, I was not able to see your video moving. Okay, so if you're happy and you know, touch your nose. If you're happy and you know, touch your chin. If you're happy and you know, touch your chin. If you're happy and you know, touch your ear.
Yes, this side.
How many of you were about to touch your nose? Raise your hand.
I heard ear.
Yes, because you were observing me. So even if you were listening, but you are more focused on my body language, on my actions. So actions speak louder than words. So in public dealing, even when you are using the right words, but if our actions are not in coherence with the verbal communication, the other person is able to judge from our expressions. It could be facial expressions, it could be overall behavior. So body language includes a lot of things, like for example, your facial expressions, eye contact, gesture, posture, touch, space, everything is part of body language. So if I may ask you, what are our usual facial expressions when we are interacting with the patient? Number 1, 2, 3, 4, 5, 6, or 7, 8, 9. Which one? Number
1.
Number 1.
I think number 5. The center one.
Number 1.
Number 1 is when we are happy.
Number 1 and number
1 when we are happy. Number 1, we have just entered the hospital. We are cheerful. But after a few minutes, actually it is number 5. And what is visible on number 5? What is
I don't care.
Hardly
Non-reactive.
Non-reactive. Why do we keep this expression? Why do we keep this expression?
Actually, I think it's a defense mechanism to prevent emotional burnout.
No, it's not about, it's like we are more focused on our some kind of a work or thinking about something. That's why it changes to that expression.
But would you like to be treated by a doctor who has this expression when you are interacting with them?
No, not at all.
Not at all.
But yes, it's only when we
Somebody
are
said emotional burnout. Somebody said emotional burnout. I
To
could get to
avoid.
know. So Sneha, honestly, I understand your concern, and this is what is the medical training. We say that you have to be very professional and don't get emotionally attached with the patient. So emotional detachment does not mean being insensitive to the patient's emotions. I think we need to have that clarity. We don't smile.
I fully agree.
We don't smile. There's a reason. There's a hidden agenda. We don't smile कि patient मुझसे कुछ ज़्यादा ना मांग ले. मैं मुस्कुरा के बात करूंगा या मुस्कुरा के बात करूंगी, patient ज़्यादा सवाल करेगा. फ्रेंडली होने की कोशिश करेगा. अगर पेशेंट फ्रेंडली होने की कोशिश करता है, यू कैन यूज assertion. पेशेंट अगर मुझसे पूछेगा, मैडम कहाँ रहती हैं आप, कितने बजे ऑफिस से या हॉस्पिटल से कितने बजे वापस जाती हैं, आपको कोई लेने आता है या आप अकेले जाते हैं, आई नो ही इज नॉट क्रॉसिंग द लिमिट. आई कैन बी फर्म हियर. आई कैन से कि आपकी जो इलाज को लेकर अगर आपके कोई सवाल है, आप पूछिए, मेरी पर्सनल लाइफ से आपको कोई लेने का मतलब. But for that, having a blank face and not having any expression is not a good idea. Because it's very important to understand the importance of smile. Trust me, smile can change the milieu. The moment you enter bank or you enter any government office, and if the person sitting there sits like this and looks at you, मन में आ जाता है ये काम नहीं करेगा, ये खड़ूस है ना. और वही कोई हंसते हुए मिलता है, आपकी एनर्जी 10 गुना बढ़ जाती है और आप कहते हैं मैम आपसे बात करके बहुत अच्छा लगता है. जैसे डॉक्टर नेहा ने कहा कि मैंने उसके साथ सिर्फ बात करी और उसने कहा मैं मेरी 70% तकलीफ ठीक हो गई. So
I think it also depends on the area, right? I mean, if it is an ICU or a emergency area, thoda pleasant face to
very
rakhna
good
padega.
question, Sneha, very good question, very good question. I'm very happy that you are not taking what I'm saying in without analyzing. Yes, we all know in critical care areas we cannot smile unnecessary, we cannot giggle unnecessary, but having an expression that I am there for you, I want to help
appropriate is very
appropriate.
important.
So you will see wherever I will advise you to smile, it will be in bracket wherever appropriate. But in lot of areas there is no need to have a blank face. I could have sat like this and delivered the whole lecture with a very blank face. I'm sure half of you would have closed your videos and would have been doing your household chores. It's
coming across as somebody pleasant and cheerful is also important. Than
important.
As somebody very sullen or very uptight and stoic. That is not always done.
I completely agree with you, Dr. Amrit, that I think we have to remember smile plays a very big role in a person's, interaction. So if you want, you can smile. If patient tries for secondary gains, you can assert. अगर पेशेंट आकर मुझे कहता है कि मैम मेरे को एक हफ्ते की बजाय आप एक महीने की दवाई लिख दो, आई कैन से कि देखिए जो सिस्टम है मैं उसको तोड़ नहीं सकती. सिस्टम है कि एक हफ्ते की दवाई लिख सकती हूँ या आपको एक वीक की दवाई लिख सकती हूँ, उससे ज्यादा नहीं लिख सकती. But I don't have to be rude or I don't have to be, having that expression. So facial expressions of anger, irritability, unhappiness, or attitude that I am more than you, even if you don't want, they are seen. They are seen by people. It reflects your feeling and your attitude. So you may say, no, I was not rude. You may say, no, I'm not irritated. But if your body language says you're irritated, it's visible right on your face. So very quickly, I want to take you through this quiz. I wish we had time, I would have taken you the whole quiz, but just to give you a taste of this, let's see if we can read emotions of others. How good are we at, so if I may ask you this expression, what do you think this face is expressing? Options are embarrassment, fear, sadness,
embarrassment,
surprise.
So I would say write in the chat box so that we know which is the highest, option opted by all of you. Fear, embarrassment, sadness, surprise. Okay. So I can see in the chat box some answers. Embarrassment, fear, not a good surprise. Okay. So embarrassment कर दे, पता लग जाएगा क्या गलत है, हाँ? Okay.
Embarrassment, yes.
चलो embarrassment कर देते हैं.
Flushing of face is also there.
हाँ, तो देखते हैं क्या निकलता है. Fear.
Yes, you are.
Okay. We'll take 5 questions. There are more, but then we will take only 5 because we are short of time. Okay. Now this facial expression is telling about flirtatiousness, interest, happiness, politeness. What do you say? Chat box. Right in the chat box. So I can see some answers. Happiness, interest, happiness. चलो happiness ज़्यादा लगा रहे हैं. सब लोग happiness कह रहे हैं तो मैं happiness कर देती हूँ. Let's see where we where we stand. Okay, happiness, wonderful. Clap for yourself. You have been able to identify correctly. How about this third one? This one is face is expressing sadness, pain, anger, disgust. क्या कहते हैं? Anger? 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 Okay, all of you are saying anger. Okay, I go with you. But I think मुझे लग रहा है कि disgust है. देखते हैं, anger भी हो सकता है. Anger, very good. Absolutely right. So you all are good at reading expressions. That's very important, you know. From face, if you can make out what is this person feeling, it's easy to handle. Yeah, somebody said disgust also. Okay. This face is expressing embarrassment, sadness, or amusement, shame. Okay. Amusement का ज़्यादा आंसर आ रहे हैं. Amusement, okay. Embarrassment, amusement. चलो amusement कर रही हूँ आपके कहने पर. Okay. Embarrassment. So you can see we still need to learn how to go about reading emotions, reading experiences. And that's very helpful if we can actually, you know, see the expressions, and on the basis of that, we can change our communication style. Another important, you know, body language is our eye contact. You must have experienced a lot of time. You go visiting somebody, that person is sitting on a table, so if he or she is in authority, you are standing there, but you're not standing there. That person is just not attending to you, not looking at you. How do you feel in that moment? Good or bad?
Bad.
Bad.
Very often we give this treatment to our patients. They are there in our visual field.
Bad and uncomfortable many times.
In healthcare,
everybody wants to be seen and visible. If you're not
Yes.
giving attention, then
When
it
you
is not
see and acknowledge, you're acknowledging their presence.
Yes,
You
we
are
feel
acknowledging-
ignored.
Yes, they be ignored and non-existent. In healthcare with patients, it's all the more important to make eye contact. Why? Can you guess?
there are already so many anxieties and fears going on in the patient's mind. So we need to be rather more careful in how we are behaving.
And
Trust and
reassurance is
trust.
very important.
Yeah.
And the
Trust and
confidence of patient increases when we
What do
give eye
others
contact.
say? Yeah, what do others say?
Because the patient is always looking for trust. Can I trust this person?
Absolutely.
Am I receiving enough care? Am I receiving enough care?
So when you look at your patient gets this feeling that yes, you are listening to that person, you know, attentively. You are trying to connect with the person. Also, when you make eye contact and look at the patient's facial expressions and body language, patient झूठ बोल रहा है, सच बोल रहा है, घबरा रहा है, शर्मा रहा है, intensity of pain, intensity of suffering, all that you can find out when you make eye contact and look at the facial expressions. Yes, Santosh, you're right. Confidence, the patient will have confidence in you when you make enough eye contact and communicate that, yes, I'm listening to you. So protocol for eye contact is, in professional relationship, it's always good to look at the eyes and above the eyes. In personal relationship, we can look eyes and below the eyes, nose and lips area. But in professional relationship, one should avoid looking below the eyes. The acceptable protocol is look at the person for 2 to 3 seconds and shift your focus. Don't stare. और सिर से पैर तक तो बिल्कुल नहीं देखना किसी को, because that can be very upsetting the other person. In this picture, you see two postures, posture A and B, which is okay. Which is okay? B is okay?
A is better.
B is better. What do others
Sometimes
say?
A, sometimes B. Sometimes A, sometimes B.
Actually, no.
Feel A is comparatively better
we
than
can sit in our own spaces.
I will not be comfortable with a doctor sitting like A.
Yeah.
Actually, none of them. A is very closed, B is very closed, and A is very casual. So the right way is lean forward and try to connect with the person. And in chair, you should never rock like this. That's not a good idea. When you rock like this, the person feels, not comfortable continuing. Yeah, that you are disinterested. So leaning forward and occasionally nodding, it encourages interaction. Touch. In healthcare, touch is unavoidable. We all need to touch the patient for various reasons. Examine करना है, injection लगाना है, dressing करनी है. For many reasons, we need to touch the patient. So that's unavoidable. So on one side, you can actually, communicate empathy and understanding and care. But on the other side, we have to remember the patient might feel very uncomfortable when somebody is touching them. Because for them, you are a stranger. So when you are, and of course we all know a soft touch like this can give a sense of care to the patient. There's some echo I can hear. Can you keep your device on mute mode? It is okay. Yeah. So soft touch on the shoulder, we know can give a sense of care, but we need to be careful because we know touch can create misunderstanding. And especially, if you're a male therapist and a female patient, you have to be very, very careful before you touch the patient. It's always a good idea to signpost. What is signpost, by the way? Can somebody unmute and speak? What is signpost? Signpost is
in some way or the other, you just try to show the patient where you are going to touch, whether on the shoulder or something. You just take a hand little near without actually touching the patient.
Wonderful. So verbally, actually, even if you say, I need to examine your throat, may I? We think it's an implied consent. We all think that because the patient has come to the OPD, so physical examination has an implied consent. Patient does not know. So it's always good to signpost before you touch the patient. I need to touch
you
your
have
ear.
to ask for a consent.
Yeah, permission. Yeah. Usually it's more like a rhetorical question. Is it okay? And they will say yes. But always ask this. Because if they don't want, they have the option to say no. For example, in certain religion, they don't like to be touched by a male therapist. I remember in one of the hospitals, this was shared by one of the participants, that an ECG technician did ECG for a lady. And we all know that mostly ECG is done by male technicians. So this lady, she got her ECG done and she came out and she told her husband something. He got really furious. He literally went inside the ECG room and caught hold of that person from, his collar. That how dare you touch my wife, and why did you not inform that you are the one who is going to do these ECG? So we might say, what is new about it? It's a regular thing. Sometimes patients are not okay. So it's always good to signpost before you touch and seek permission verbally. Is it okay? If the patient doesn't want, they will say no. Even hand movements communicate. A lot of time we use hand movements which might upset the other person. Showing finger, bahar chaliye, aap bahar chalo, tum idhar aa jao. When you use finger like this, they feel offended. And please remember never to point out finger towards the diseased body part. आपकी जो ये वाला lump है ना, आपकी जो यहाँ पे swelling है ना, that's not a very good idea. Even hand movements like what can I do or stop, we often use knowingly, unknowingly, but then they are not really very welcome. Whom do you think he looks like?
In first pic, you look like a wrestler or maybe some kind of a so he's well dressed up in the second look, which has completely changed his impression. The way the first look was very casual.
So you can well imagine if you're not appropriately dressed up, how your patients can misunderstand you. A lot of time when I'm interacting with the medical students, when girls come and tell me कि वो patient मुझे sister बुलाते हैं, वो doctor नहीं बुलाते हैं, because that's a common bias they have. All male are doctors and all female are nurses. But if you're dressed up like a doctor, people will treat you like a doctor. It's very important to dress up appropriately for the occasion. So the way we carry ourselves in public is being observed. So मैं चप्पल पहन के अगर चली गई या मैं अपने casuals में चली जाती हूँ, patient will feel that I'm not appropriately dressed up for the position. So I think things like, colors even that we choose to wear, all bright colors like red, yellow, they're very nice in personal life. There's nothing wrong in, wearing them in your personal life. But in a professional setup, it is always good to use, colors that are soothing to the patient, and also they feel that we are with them. Now, if I'm wearing very red color, bright sari and with all accessories, and I'm attending my patient, and patient is in pain or is really suffering, she might think that I'm not affected by her pain. But we have to kind of, communicate that we understand what you're going through. So 3 questions that will help you in, choosing appropriately. One is, does this cloth fit me properly? Any cloth that is too tight, too loose, too short, I don't think that will work in a setup like healthcare. Clothes have to be comfortable, because whole day you have to run up and down, you have to bend, you have to walk, you have to jump sometimes, and you have to even sometimes, do very difficult things physically. So the clothes should be comfortable. And third question is, am I dressed appropriately for my position and responsibility? If all the questions are right, then I think the dress is right. So you'll be surprised to know that you are treated the way you appear. If you are dressed up smartly, people think that you are very professional, you are very intelligent, knowledgeable. So make sure that your appearance, kind of communicates that you are really good in your work. Another part of body language is personal space and privacy. We all carry a bubble around us, and we like that bubble to be respected. So anybody coming closer to us will suddenly give us, make us uncomfortable. Similarly, patients also feel uncomfortable. They like the person to maintain sufficient distance. But we know we have to go closer sometimes when we are examining the patient or doing a procedure. So a safe distance is 2 to 2.5 feet distance from the patient. In case if you need to go closer, again, I would request sign close and seek permission, because otherwise they feel uncomfortable. Especially with young adults and female patients, we need to be careful. Respecting patients' privacy and confidentiality is very important. This picture I received from one of the participants. So you can see there's a child lying on the table, and there are people who are, kind of looking at him and discussing him as he's sleeping. A very sad situation. I think we need to be more mindful of patients' privacy and their psychological health also. Similarly, when you're examining the patient, make sure that you cover the patient appropriately, use screen guard, don't have unnecessary people around, and examine the patient in a very respectful manner. This is very important. A lot of time, the patient comes and we make them wait. We may make them wait for many reasons. Abhi aur patients hai, abhi aapka number nahi aaya. Or we make them come again, couple of times. See, I think making the patient wait is increasing your workload. That is one thing. Second, in one visit, if you can accomplish as much as possible, you reduce the number of visits. That much time you save for yourself, and you can use it for other purpose. So valuing patients' time, especially they lose their days, productivity, they're unnecessary waiting. And it's not just the patient, it's usually a family member accompanying the patient. Sometimes they have elderly parents at home, sometimes they have a child at home. So a lot of, their own life challenges. So valuing their time is very important. The whole idea is, through all this, what we have discussed, display of respect and care at every point of contact. And it's not just the doctor's responsibility. I think each one of us is equally responsible to create that culture where we are more respectful towards our patient, right from the entrance, from the security guard to the front desk staff to the other, general duty assistants and nurses and technicians and everybody. They need to display respect and care. And honestly, see, all paraphernalia is for the patient. Unfortunately, we are very nice with each other, but when it comes to patients, sometimes we are very, we are not very cordial with them. So some of these behaviors we should avoid. They're non-verbal, but then they communicate a lot. Person is talking, we start looking away, or we start staring at the person, look sarcastically. We close our eyes, use unpleasant tone to communicate. I'm not interested. Or we start playing with phone, or we start doing something, or we start walking away also. All these are not a very good, gestures. So to sum up whatever we have discussed in this session, I want you to carry these 5 essential skills with you. And they are, number 1 is building rapport. If you can remember these 5 skills, I can assure you your communication with your patient and with your team is going to improve and become better. 1 is building rapport. If I may ask you, what is building rapport? What is building rapport? What is building rapport?
It's mostly
Starting
about
that
developing
connection.
that comfort.
I would say if you
Comfort
raise your
with
hand and answer turn, because see what happens, everybody should get a chance and I should know who all are part. So raise your hand so that I get to know. Okay, Dr. Amrit raised her hand first. So maybe Dr. Amrit, you can go ahead. Yeah.
It's just that how comfortable the person feels in communicating to you about the problem. So it is more about bringing the patient to that comfort level and feeling secure and assured and everything.
Wonderful. Thank you for your answer. So building rapport is for the patient. Somebody else who would like to answer this? No, I want somebody.
For us also.
Dr. Amrit, hold on. Dr. Amrit, please hold on. I want everybody to participate.
Yeah.
Dr. Manisha, is it for the patient only?
No, ma'am. Building rapport is for ourselves, for long-term relationship, and for the better outcome of the treatment, and for a long.
Hold on. I would say, give me very short and crisp answer so that we can have more answers from all of you. Thank you for that answer. So very honestly, building rapport is not just for the patient. It is mutual. I agree, Dr. Amrit, with you. It is for both of us. We think it's for the patient, so we don't want to apply. It's not just for the patient. We also need to be comfortable to talk to the patient. 1. My second question to you is, does it take time? I want somebody else to answer. Does it take time? Raise your hand, please. Whoever wants to answer. Yes, Aditi, go ahead.
Yes, it takes time. Like patient comes for the first time to see you.
How much time, Dr. Aditi? Hold on. How much time will it take? It's a rapid fire round I'm doing with all of you. How much time will it take?
After 1-2 visit.
After 1-2 visit, okay. How many of you agree with Aditi? Raise your hand. How many of you agree with Aditi? No, that means you differ on my opinion. Santoshi, what do you say? How much time will it take to build rapport?
Initial 5 minutes, less than 5 minutes when we are introducing patients.
How many of you agree with Santoshi? Sorry, it's a rapid fire round. So, how many of you agree with
Yes,
Santoshi?
I agree with her.
You agree with her. Dr. Neha agrees, Dr. Kundan agrees, Dr. Amrit agrees, Dr. Manisha agrees.
Even I do agree with ma'am.
Okay. Those who are not agreeing, now raise your hand if you don't agree with Santoshi. Hold on. I'll come to you, Dr. Kundan. Hold on. Payal is not agreeing. Payal, why are you not agreeing and what is your explanation? Go ahead. Unmute your device,
So
dear.
the first of all, when they look at you within 8 to 10 seconds, how you are welcoming them or how you are making them confident enough, just a non-verbal, how you said the non-verbal communication. So I think that will be the part of it.
Building rapport does not take time.
Yeah, it starts the moment the patient enters, the moment you come across.
Hold on. The building rapport does not take time. It's more of a factor of your intention to build rapport with the patient.
True.
Let's do a quick exercise. I'm going to send 2 of you in breakout room, like in pairs. I'll be sending all of you in pairs. So how many of us are there? We are 12. Anybody who is switched off the I think Dr. Priya is there. Anybody who is not visible here? Okay. So excluding me, you are 11 of you. Okay. So I'm going to send you to the breakout room for just 2 minutes. Just 2 minutes. And you have to discuss with each other. The prompt is, if I was not in healthcare, where would have I been? So the exercise is, first one person will speak, the other one will listen. After a minute, the other one will speak and the first one will listen. And the topic that you have to talk is, if I was not in healthcare, where would have I been? So I'm making breakout rooms. I'm creating breakout. Is the task clear to everyone? And please, 2 minutes and come back. Just 2 minutes. Keep that time in your mind. Okay. So, okay. So I'll create the breakout rooms like 5. Okay. So please choose. In one group, maybe you will have no. We are 3. No, 3 people. No, hold on. I'm going to increase the number. Yeah, recreate. In one group, you will have, 3 members. Otherwise, you will be in 2. So, Dr. Priya, I will add someone with you. Give me a second. Number 4. Yeah. So I have moved Sneha with you. So you'll have to join the group. Please join. Yeah. Dr. Amrit, please join the group. Dr. Amrit, you have to join. Dr. Amrit and Deepika, both of you need to join. Only then you will be able to be together.
I haven't got a request to join. Would I be getting something in the link or something?
I had sent the prompt and you were supposed to join. Yeah.
I think I came back out of that. Could you please resend it, Doctor?
Okay, so I will reassign you. 1 second. Give me a second.
I think you had assigned me to 5, room 5.
The thing is, actually, I'm not able to move you from there.
I think no problem. I saw an option which says that I can join room 5. I'll do that.
Oh, go ahead, please. Yeah, go ahead. So you could do the activity?
Yes.
Yes.
Both of you?
Yes.
Both of you? Okay, wonderful. So I'm waiting for others too. I'm waiting for everyone to join. They're still talking. So Dr. Deepika, you could interact with Dr. Amrit?
Yeah.
Okay. Great, great. And Priya spoke to Sneha?
Yeah. Yeah.
Dr. Aditi and Dr. Kundan were together. Fine. Okay. Let everybody come in and then we have a discussion around it. It's only the paucity of time that asks me to, rush through. Otherwise, it can go on and on. But I want to cover a lot of material. Okay. So all of you are there. If I may ask you, what was the feeling? I'll ask Dr. Kundan because he has not been able to share his thoughts. What was the feeling after doing the activity? Not what you discussed, but how did you feel after doing the activity?
I felt good about expressing, to a stranger. Maybe I may call it as a stranger. Yeah. So, but then there were things which I may have spoken or wanted to speak, but I was not speaking. Maybe because it is the first meeting or some prejudice and all. So only I was sticking to the question, task which was asked, but rather than being to the point and not expressive without any just like but if somebody is meeting some stranger is meeting in a consultation room or anywhere else, so that
So next time when you interact with Aditi, do you think it will be better? You will feel more comfortable?
Yes,
more
possible.
Comfortable? Okay.
Possible.
So I give you just 2 minutes time. And I'm sure slowly some of you must be feeling more comfortable with each other. If I may ask Dr. Priya, how did you feel interacting
I
with
feel
Sneha?
very comfortable, happy interacting with Dr. Sneha.
So next time if I put you in an activity together, will you be more comfortable?
You're obviously more comfortable, yes.
Yes.
So actually building rapport does not require time. With just this 1 or 2 minutes of interaction, now you're slowly becoming comfortable. Imagine, in spite of being in the same department with a lot of people around us, we don't interact with them. We don't make an effort to build rapport with them. I remember I was doing a session for one of the very big hospitals. The head of the department of anesthesia was attending the program. He said, this girl works in my ICU. I see her day in, day out, but this is the first time I've sat like this and I'm interacting with her. I've never had a chance to talk to her. And I'm sure there will be people around you whom you see every day. We don't spare a minute to interact in an informal manner. Now imagine when a patient is coming to you and you proactively build rapport and try to interact with the patient, patient's inhibition will slowly start going down. If you build rapport, most of the information you will receive from the patient in a manner that will help you diagnosing accurately. So is building rapport like being friends with the patient? No. Building rapport is a professional relationship. You are creating comfort and familiarity for the purpose of therapeutic relationship. So, but that has to be valued by all of us. Now, coming to how to build rapport, again, very simple things, not a very big thing at all. The whole idea is that we should know that building rapport is not going to take time and it is not being friends. For example, the moment the person comes into your visual field, you lift your head, look at them, make eye contact. Usually patients greet us. So you just need to respond. Patient will say namaste. Will say namaste. Patient ने नहीं कहा, मैंने कह दिया हाँ जी नमस्ते आइए. So greet the patient, smile if appropriate, because if you think the things are not very bad, there is no harm smiling because that makes the patient comfortable. Offer place to sit. Show them where to sit. A lot of time there are two consultants sharing one room and there are stools. Now patient does not know whether I should be sitting opposite side of the doctor or I should be sitting next to the doctor. And all chairs look alike. So there's no harm showing where to sit. Introduce yourself, especially if you're going to meet the patient for the first time. Telling that I'm Dr. So-and-so and I'm going to attend to you is letting them know that you are a doctor and you're not a nurse. Also, ask for patient's introduction. Why do we need to specifically ask the patient introduction? Any idea? क्या नाम है आपका? या नाम बोलकर आप पूछते हैं, हरिप्रसाद नाम है आपका? Anyway, both are okay. वैसे तो ये पूछना चाहिए क्या नाम है आपका? Because I remember in one of the program, one of the nurse said, वो इंजेक्शन रूम में काम करती थी. She said कि एक पेशेंट आई, मैंने उससे पूछा गीता नाम है, उसने सिर हिला दिया. मैंने बोला कुत्ते ने काटा है, उसने बोला हाँ. मैंने उसको इंजेक्शन लगा दिया, बाद में पता लगा ना वो गीता थी ना उसको कुत्ते ने काटा हुआ. So there's a risk. So it's better to ask what is your name, especially in heavy OPD, heavy volume, workplaces. It's always good to ask from the patient, "Aapka naam kya hai?" so that you are sure the OPD slip that you hold in your hand is that patient. Even taking attendance introduction is important because you never know, while collecting history or while conversating with the patient, you might need to ask something very serious but very personal. So it's good to know who is this patient and also asking, are you comfortable in front of this patient, me interacting with? Small talk before the big talk. What is small talk before the big talk?
The lighter details of where they are from, what is their age. It builds rapport, it also collects information. And then we'll move on to the bigger things.
कहाँ रहते हैं आप? है ना? क्या करते हैं? साथ में कौन आया है आपके? ज़्यादा देर वेट करनी पड़ी क्या? So they feel, and you get to also know patient's communication skills. जब वो जवाब देते हैं ना, तो आपको पता लगेगा उसकी language skills क्या है, communication skills क्या है, how expressive is the patient. So that will help you, making patient comfortable and also knowing patient listening. And throughout, demonstrate interest and respect. When the patient is talking, show that I'm listening to you. I think if you look at all the points that I've given, how much time will it take doing all this? Hardly any time. It's just a matter of intention and desire to make that. Second point that I want you to carry home with you is paying prompt attention and attentive listening. A lot of time, patients are very unhappy with us when we don't pay them attention. They are standing in our visual field. I'm not saying that you leave everything and attend your patient. Even if you're busy doing something, just saying this much कि आप 2 मिनट wait कर सकते हैं, मैं ये काम जो मेरे हाथ में खत्म करके आपसे बात करती हूँ. That's all. Please बैठिए, मैं आपको अभी बुलाती हूँ. So just telling them that I have seen you and I'm going to attend you, but let me finish my work. Even that is okay. And in case if I'm doing something which is not very important, I can put them on hold immediately and say, हाँ जी सर बताइए किस लिए आए हैं. So prompt attention and attentive listening is very, very important. Now I have a question to ask you. 1 second. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So we have still 10 slides, which will take at least 20 minutes. I think I would close it here because I want to do those activities with you and help you understand.
Yeah, please.
And,
Anna? Yeah.
So we will cover a part of it I've left. I want these 5 skills to go with you throughout your, wherever you work in your workplace. But we will cover them in the next session. Are you all okay with this decision?
Yes, ma'am.
Because जबरदस्ती नहीं cover करना है. मुझे कुछ ऐसा नहीं कि मुझे खत्म करना है. I want you to take this with you. So I'm quickly sharing the feedback form with you. Whatever you have, whatever your feedback is, please share your feedback before we close this session. And in case, meanwhile, you have any questions to whatever we have covered, I'm ready to take those questions.
I think for me, we're working in a government setup. A big challenge is when I enter a room and everyone at a time comes towards me, and it becomes difficult prioritizing, especially in emergency areas and ICU areas. I would want to first go and check the emergency things first, but then everyone wants to have a word. Prioritizing, and it becomes a sensory overload for me. So when you say give prompt attention, I fully understand it's so important, but then how maybe in such challenging situations, what can be done?
So, Sneha, honestly, I think we need to really learn management simultaneously because a lot of it is your OPD management. How do you maybe much before you, if you suppose if you are a resident and if you have an intern under you, or if you have a general duty assistant under you, or if you have a nurse under you, giving them the responsibility of at least having list of patients, or at least having their OPD slip one under the other, so that who came first. Because normally in OPD we serve first come first basis, so we can't say
No, OPD is easy. OPD is easy because it is 1:1. ICUs and emergencies are high tension areas where most of the medical legal and fights happen because it is so emotionally charged. But then that is the area where everyone wants to talk to you as soon as you enter the room. But then
your assertion will play a very big role. I'm going to talk about it at length because that's one topic I want everybody to learn and practice and implement in life. So there, for example, if I have 10 people waiting, and if I say in a polite but firm manner, say I can't attend all 10 of you, but I want to give time to each one of you. So is it okay if I talk to this family first because I have something important to communicate with them? So you are seeking permission, but you already have an answer into it. You are seeking permission. I'm ready. I want to talk to all of you. I want to listen to your problems. I want to talk to you and answer your questions. But I want to speak to this family first because I have something important to share with you.
But there's also this, for me, it's like a double thing. I mean, one, I also don't want to miss that the attender is saying something very important, yeah, so something which I have to attend right away.
In ICU, in critical care areas, I would always suggest that you must speak to the family one-on-one. Especially, I talked about social triaging, where you have to see if the prognosis is poor, outcome is going to be, not good. Or if you think the family is very apprehensive, very anxious, they're aggressive, attending them promptly, attending them first, there's nothing wrong. They're not that I have bowed down to their pressure. It is being understanding the human psychology here. If I can calm them, half of my pressure is gone. That we have read that book, Eat That Frog, that says what is important, attend that first so that you are unburdened. So if you have been able to send them satisfied, half the job is done. The rest you can speak. But whenever, if you are in ICU or in any critical area, have enough time for the patient's family.
Yeah.
Have enough time. Because that is what is going to give you peace of mind. If you don't talk to them, if you don't answer their questions, they're mumbling, they're cribbing, it can boil down to violence. That's very
it was much easier in a private. I mean, I think my challenge is as soon as I enter for the first few minutes of my day, when I'm entering an emergency area, my first priority would be just see airway breathing circulation of all the kids and come back. But then everyone sort of wants attention immediately.
Even if you say, so I remember I was talking to a CMO. She said, I asked her, what is the rate of violence in your emergency critical care area? She said, actually nil. I said, why? She said, every time we take in a patient, we inform the family that please let us settle the patient and I'll come back to you and I'll explain everything. Give me that time that I can settle your patient. They know their primary goal is to get the attention for their patient. They're more cooperative in that moment. After you have settled the patient, go and talk to the family, explain them, even if it is poor prognosis, let them know. Let them clearly know. Answer their questions because you need to eventually prepare them for the outcome. In case if the patient is not going to survive, it's better to let them know, see, we will do our best. But right now, I have no clear answer to tell you that what is the condition. It's not good. It's honestly not good. But we shall do whatever best possible we can. I think that's how you have to approach. We are going to talk about this in number of sessions because I know major challenges in critical care areas. So when you come to handling aggressive patient party, breaking bad news, disclosure of medical errors, those topics will have a substantial amount of discussion about it. But thank you for asking that question. Any other question or doubt anybody wants to ask? So I've received 5 responses. Those you have done in the chat box so that I know. Yes, Payal, you have something to ask. Go ahead, please.
Yeah. So, ma'am, it's like how today we have learned about, you have to be affectionate toward your patients and how good you have to be a little happy face or something. So my daughter, she's having in the school, they given the project about sympathy and the empathy. So she came and she asked me, Mama, being a doctor, you show sympathy towards your patient or you show the empathy towards your patients? And that really make me feel wonder what should I answer.
What was your answer?
It was very tough. I said it's like, it's tough. We cannot 100% show the empathy towards them too. And not every time we have to be a sympathetic towards them too. It varies from patient to patients and their diagnosis and the way they are coming to it. So yeah, but
so don't worry, we are going to cover this, in the next session. 5 skills that I said I want you to keep in your pocket always. First one is building rapport. Second is prompt attention, attentive listening. Third is positive attitude towards patients and your work. Fourth is respectful and dignified care to your patient. And fifth is empathy. I've kept it at the end because that's the most important, point that you need to have on top of everything. And you'll get a lot of clarity on the difference between empathy and sympathy when we will talk in the next session. So don't worry, we are going to talk about this at length. I've received 7 responses as of now. Who all are still left? Uh, 7 responses. Dr. Kundan has submitted, Dr. Amrit, Dr. Priya, Dr. Payal, Dr. Santoshi, Dr. Deepika, Dr. Aditi Goyal. Who all are left? I think Mamta is left. Mamta, you are there? Okay, Dr. Manisha, I have not received.
Yes, ma'am. I'll do.
Okay. Dr. Manisha, I have not received. Dr. Neha, I have received now. Who else is left?
I'm finishing mine.
Okay, sure. So by the time the responses are received, any question, anything that you wish to say?
Like I said in the form, one challenge is if the previous communicator had already done a bad job, and even before you have the chance to interact with the patient is already shut off or is agitated or is in a distrustful position and is assessing you in a bad light already. And you have limited time. So how to diffuse the situation to start the entire interaction on a blank state? What can be some opening statements?
I think to start with, you have to assure that I'm there to help you. मैं समझ सकती हूँ कि आपका किसी से बात हुई और आपको बुरी लगी है या आपको अच्छी नहीं लगी है, पर मैं आपकी बात सुनना चाह रही हूँ, आपकी बात समझना चाह रही हूँ, and I want to help you. Do you want to talk to me? So you very clearly you're communicating that I want to help you. I'm there to help you, but you need to calm down. आप थोड़ा सा अगर शांत होकर मुझे अपनी पूरी बात बताएंगे, तो जो भी संभव सहायता होगी मैं जरूर करूंगी. But for that you need to calm down. आप गुस्से से बोलेंगे.
So I should what I'm noticing in their body language, I should articulate it, saying that मुझे लगता है कि आप ऐसे गुस्से में हो. मुझे लगता है कि आपका your experience wasn't good with the previous person. Let us start afresh.
And I can't blame that person. नहीं वो बहुत बदतमीज है, वो सबके साथ ऐसे ही बात करते हैं. आप उनकी बात का पूरा मत. No unprofessional.
नहीं जी.
I just say कि I can see you are very upset. I understand. आप अगर आप थोड़ा आराम से बात करेंगे, बैठकर बात करेंगे, मैं आपकी बात सुनने के लिए तैयार हूँ. I want to help you. But आपको थोड़ा शांत होकर बात बतानी पड़ेगी. Moment they will receive.
Is it a good idea to let them vent their feelings first?
There's no harm. Actually, it helps because once venting itself gives them relief that okay, somebody is ready to listen to me. Usually, people are not ready to listen. That's their common complaint. कोई सुन के राजी नहीं है. कोई सुन के राजी नहीं है. That's their common complaint. आप कहते हैं आप बोलिए, मैं आपकी बात सुनना चाह रही हूँ, मैं समझना चाह रही हूँ कि आप क्या प्रॉब्लम क्या है. And you allow, of course, you can't allow them in ICU, you can't allow them in OT, you can't allow them in labor room. But if it's your counseling room or your consultation room where you're sitting one-on-one across the table, and if you allow them to vent, there's nothing wrong. Corridor में मत करिए, open area में मत करिए, because that can fuel aggressive reaction. do it
In
in
a
person,
common
wonder.
a concern, if I allow them to vent, my fear is the beside the patients beside them, because I'm talking in a government setup or in a medical college. Usually there are common wards. इसका frustration कोई और पकड़ लेगा. Everyone else will start
के लिए
distrusting.
पब्लिकली नहीं करना. मैंने क्या बोला है कि कभी भी ये जो एड्रेसिंग देयर कंसर्न्स शुड नेवर बी पब्लिक. आप जब मेरी
Okay.
स्लाइड्स देखोगे या डिस्कशन होल्ड करूंगी, पहला पॉइंट है सेग्रीगेट देम.
Okay.
Segregate them, take them to another place, make them sit, offer them a glass of water, and then assure. देखो मैं आपकी हेल्प करना चाह रही हूँ, इसीलिए मैं आपको बैठाकर आपकी बात सुनना चाहती हूँ, पर आप बताएंगे, बात होगी तभी होगा. अगर आप बाहर खड़े होकर शोर मचाएंगे, हो सकता है आपका गुस्सा निकल जाएगा, लेकिन आपकी प्रॉब्लम नहीं सॉल्व. सो यू आर सेटिंग लिमिट ऑल्सो कि देखिए अगर आप आराम से बात करेंगे मैं कर पाऊंगी. आप चिल्लाकर बात करेंगे, मैं तो आपको हैंडल नहीं कर पाऊंगी, तो मुझे फिर कहना पड़ेगा भी somebody else should come and talk to you. आपकी चॉइस है, आप बताइए क्या कहते हैं. You throw the ball in their court by giving them the options. What is doable, what is not doable. क्योंकि हमें कभी ऐसा करना नहीं पड़ा, इसलिए सब कुछ नया लग रहा है. सीखना पड़ेगा, हम सबको सीखना पड़ेगा.
Another, I mean, I'm sorry to take time. I'll probably ask in another session. Yeah.
So it's almost like 20 minutes past.
Yeah.
And for all of, for me, it's okay because it's day for me. But I'm sure for you all, it is very late. So maybe, I mean, I'm glad that you're asking questions, Neha, because that's what is this purpose of this program. Unless you will have clarity, like Payal asked, that difference between empathy and sympathy. A lot of us don't express empathy because we think we are going to exhaust ourselves. Empathy does not burn you, it actually fuels you. Empathy fuels you. It gives you positive energy. It accuses you with
if you have energy. I think that's true. If we have some methods of de-stressing and
maybe talk about it. Ask me a number of questions. We are going to talk about these 5 skills once again in the next session.
Okay.
And we'll talk about it. We will definitely. Okay. Then please feel comfortable to ask questions. All others, please feel comfortable to ask your questions. Anything else?
Okay.
Before we close? Thank you so much. You all have been wonderful participants. I thoroughly enjoyed my session with all of you. Thank you.
Thank you. Good night.
Thank you. Good night.
When is the next class?
Next Wednesday.
Class?
Yeah.
Next class?
Next class will be next Wednesday. Yes.
Okay.
Right now we have.
Will it be every Wednesday? Is it
right
for
now,
every
yes.
Wednesday?
Yeah. Right now, yes. Most likely we'll stick to Wednesday only. And in case if I'll have some challenge, I'll request you to change. Otherwise, mostly I'll reserve this day for your batch. Thank you and good night. Bye-bye.
Thank you so much. Thank you.
Okay, good night.
Thank you.
Good night.
Good night.